Hockey is the fastest game in the world, featuring perhaps unparalleled skill and artistry among professional athletes. But it's also violent and dangerous. 100-mile-an-hour slap shots whiz by unprotected eyes, and players routinely careen into each other wearing what amounts to knives on their feet. The potential for injury is great, which is why the Jets have a mini hospital mere meters from the ice surface.
Can you tell us what happens once you go down the hallway?
Yeah, usually you come through the bench door, throw your stick and your gloves, take your helmet off and your mouth guard, and doctor usually grabs you and wheels you right down to the room where they stitch you up, and wherever it is, they obviously clean it off and go to work and try to get you back out on the ice as quick as possible.
Every player will pay a visit to the medical room, some more than others, over the course of their careers.
Yeah, this is our medical room, which actually they just remodeled for the Jets.
That room is crucial for the treatment of every possible injury, from something like this, a gash on Jim Slater's leg, courtesy of an opponent's skate blade, to one of the most gruesome injuries ever, the severing of Buffalo Sabres goaltender Clint Malarchuk's jugular. Jetcetera was given a tour of the medical room by Dr. Peter MacDonald, the world-renowned sports injury surgeon who reattached Teemu Selanne's severed Achilles tendon in the mid-1990s.
We have an old dental chair that Dr. Salmonson used to have in his dental office, and it's really good for suturing. As you can see, it's got pedals to adjust the height, and it's especially good for facial suturing. You can see there's an examining table, but behind it there's a spine board. Of course, anybody who's down on the ice unconscious, we have to worry that there's a spinal injury or neck or back injury, so we have to treat them as though they have a spinal injury, and we have to stabilize them and take them off on a spine board in an ambulance. As you can see, we have an x-ray machine, which we never had in the Moose days. It allows us to do, it's actually a league rule that you have to have some sort of x-ray imaging. And now in the NHL, we have new rules with regard to concussions. Concussions are a big thing. And this is the modified SCAT-2, which is a sport concussion assessment tool. Everything has to be documented on the computer. There's a centralized web-based injury database. So the NHL immediately knows how many cuts there are on the go and what the stats are for concussions, etc.
The difference was our trainers were also our backup goaltenders. So if we got cut, we headed for the hills.
Medical treatment has come a long way since the late 1960s. Just ask Ted Irvin, who played 10 years in the show with the Kings, Rangers, and Blues.
1957, way back, Winnipeg Warriors, Kent Douglas broke his nose during a game. There's a Winnipeg doctor, well known, went on the bench with scissors, put the scissors in his nose, cracked his nose straight. The guy never missed a shift. So that's what the difference was. We just never took a break, otherwise they'd send you to the minors.
Hockey seems to have this reputation of being a sport where, unless you lose a limb, you're going to miss a couple shifts and then you're back on the bench.
No doubt about it. I mean, you hit your head in the ice when you're a kid, the shots hurt you, but you just keep on playing. If you sit down and miss a shift, somebody's going to take your job. So you just kept on playing. You just kept your mouth shut, never told anybody really what was happening.
With today's hypersensitivity to all injuries, especially concussions, players usually don't have to tell the doctors anything, because the doctors already know. For Jetcetera, I'm Jeff Kurbison.